Evo and how to protect your soybeans, talk to your seed dealer or your BASF rep. Grow smart with BASF. Always read and follow label directions.
At the KSMO studio, it's time for us to sit down with our friends from your community health center. We got Kelly and Taylour with us today. Hi, guys.
Hello.
Hey, how are you?
Doing good. Glad to be here.
What a great morning. I got two beautiful women in here, and they're all bright-eyed and bushy-tailed, ready to take on the world. Okay, maybe not quite yet.
It's a little early for us.
Got to give me at least till 9.
Till 9? Well, it'll be there 5 before we get finished with that. So, anyway, but we got some neat things. They've got some neat things going on that we want to talk about, obviously, and that's why they're here this morning. And first off, Kelly, good to see you, and Happy New Year to you. And Taylour, Happy New Year to you as well.
Thank you.
And we do appreciate everything your community health center does. You guys are a vital part of this area, providing some great services. People know about the dental and getting some medical care, and it really has been a nice fit for this area, hasn't it?
It has been. We've been really excited to be able to serve Salem and the rest of Dick County through the clinic in Rolla and also on the Smallmobile.
Right.
Everybody's familiar. We take care of most of the school districts in Denton County, so it's been a really natural fit for us, and we love serving the Denton County residents.
And it's a well-needed service as well. We all know that a lot of times kids literally cannot afford to go to a dentist, and this makes it very affordable for them. So, those services are vitally needed early on in life, especially because once, if your teeth really go bad early, you're going to have a problem the rest of your life.
Absolutely. We've talked about that several times before, and, not to talk too much about the Smallmobile, but really for the kiddos, it's a comfort level. They're in their school environment and kind of surrounded by their friends. They get to go out to the mobile unit and then come back to class and brag about what they got done.
It's like recess, isn't it?
It is. Yeah, we hear all the time. Hey, my own kids say, Mom, I want to go to the Smallmobile. They don't want to go to the clinic. They want to be on the Smallmobile. So it's been a really great fit, and we're just happy to provide services that are needed in the community.
And you guys do have a new dentist.
We do. So we would like to welcome Dr. Bagby, Mark Bagby. He joined the clinic at the beginning of January, and so he brings about 30 years of dental experience to the health center. As always, he's accepting new patients. He takes care of pediatric all the way up to anybody needing dentures, partials, crowns. He's seeing patients Monday through Friday at the health center, and like always, Medicaid, private insurance, and of course, the most important, the self-pay on a sliding fee scale, which has really been huge for the dental clinic. So
very good. So what number would they call to make that appointment?
Sure. To make an appointment for dental, it's 573-426-6718.
Okay. When you get the new doctor, you can get an old established doctor.
Yeah, absolutely.
Yeah, if you already have one. So,
right, absolutely.
When you have but when you get a dentist, a lot of people don't change dentists very often, do they?
Nope.
You ever notice that? Usually when you get one, if you don't like them at first, you don't go back.
Yeah, dental work is never fun. So, no, people are pretty loyal to their dentist.
Yeah.
So, we just want to get everything taken care of and really get our patients where they should be, and then just kind of get on a maintenance plan. That's what all of our dentists and hygienists would say. There's no judgment when you come in the door. We don't care what happened to your dental work for the last 20 years. We just want to make the next 20 years better.
There you go. And that's really what it's all about, because if you don't correct the problem, it doesn't correct itself on its own.
And it only gets worse.
Only gets worse. Very
Absolutely.
good. Very good. So that's really good stuff. Well, we're here to talk about a couple more different things, but one of those things, Kelly, and you might want to explain it or have Taylour explain it, is a little bit about transportation. We're going to talk a little bit about transportation here.
Yeah.
And some needs that are vitally needed in this area.
They are. So I'll just kind of start, and then I'll hand off to Taylour on what we're doing. But I think everybody knows in Phelps, Dent, even Crawford County, we don't have public transportation. We're not a large city. We don't have public buses. Even cabs are limited. There's no Uber. And so we just...
Yeah, people are shocked at that.
Yeah, I know, right?
I'll just call an Uber and say, it might be 4 hours to get one. It's fine. The guy come from St. Louis.
Right, no Uber, no Lyft. So, we joke about it, but we see every day in the health center patients that have to cancel appointments, and they can't receive the services they need because they don't have transportation. They're reliant on their neighbor, their mom, their son, whoever it might be, and then when something happens, they're unable to get the medical and dental care that they need. So we're excited to announce that we're partnering with Missouri Rural Health Association to launch Health Tran. So it's kind of an innovative model. It's new. It's a way to address the transportation issues in the counties we serve. And so I'll let Taylor kind of explain a little bit more about it. And
Yeah.
All right, Taylor, you got the Health Tran.
yeah,
Let's
she's
go.
up.
Take
We
us on a
have
ride here, girl.
Yeah. Well, going off of what Kelly said, we do have some very exciting opportunities coming up to get involved with Health Tran starting tomorrow, the 16th,
Okay.
at 1 p.m. at the St. James Senior Center. We do have an informational session. If you attend, you're not committed to joining or signing up, but it is great information about the program,
Okay.
how to get involved as a volunteer driver, and there are some benefits as well as becoming a volunteer driver. You know, the biggest perk is you get reimbursed 80 cents per mile, so that grocery trip you normally take just by dropping off a few patients at the health center. You also get reimbursed now. So you get reimbursed to go pick up your groceries and, help somebody else live a healthier lifestyle. That, again, is tomorrow at the Senior Center. But even though it's at the Senior Center, it's open to all ages. And then we also have, at the end of the month, the 30th, we have another informational session that we will be having at your community health center. So we'll have that in the clinic. And we're very excited about that as well. And then aside from Health Tran too, we also have our 5-year anniversary coming up in February. So we are doing a Patient Appreciation Day on February 28th, and we are very excited about that. We will have lots of opportunities and to get out there and have some snacks and learn a little bit more about our program, Health Tran, and just everything that we offer at your community health center.
Wow, that's a pretty full schedule.
Yeah.
So now, all right. So explain a little bit about. We're talking about Health Tran, about getting transportation to desperately needed areas in rural Missouri, and this is something I know the Merrimack Regional Planning Commission has tried to address. There's just no easy answer here, but in providing transportation, you're going to be able to actually let some of these people who can't get from point A to point B, give them that opportunity. So let's talk a little bit about Health Tran. What kind of transportation is this going to be? Is it going to be a bus? Is it going to be a car? Is it going to be a van? What is it going to be?
Yes. So like Taylor said, it is primarily a volunteer-driven program. So basically the volunteers use their own vehicle.
Okay.
And I think kind of what she was saying, so if you go to Rolla every Tuesday for groceries, go to the super center or whatever you do, you can actually provide rides for people in your community. And so you just pick them up on your way at their house, you drop them off at the health center, you go and get your groceries, and then when you're finished running your errands in Raleigh, you pick them back up from the health center and drop them off. And then you are reimbursed as a driver. So we like to look at it as not only providing transportation to your community members, your friends, your family, but for those of us who would like to maybe donate but don't always have financial means, or to kind of give back to our community but we can't write a check.
Right.
This is really a way for community members to give back to their community by ensuring that their neighbor, the person they're sitting next to at church has transportation to an appointment. In addition to volunteer drivers, we are contracting with some transportation companies. Licking Bridge Builders has already contracted. So for patients in and around Licking, if we don't have volunteer drivers in that area, we'll be able to utilize their services.
Okay.
I think looking at it from a patient standpoint, if we have patients that are listening and they need transportation, they just need to call the health center and let the front desk know. We have a mobility coordinator who's going to help manage the rides. Get those scheduled, and then there's no cost to our patients. That's what we would really like to say also. The 80 cents a mile that goes to the drivers, the health center is going to be paying that.
Okay.
So for our patients that are on the sliding fee scale, or even who have private insurance, but maybe they're in a one-vehicle home and they need to get their kids to the dentist. It
Right.
happens all the time.
Or the vehicle breaks down.
Right, and you
happen.
got a toothache and you need to get them there. There won't be any cost to our patients. What's important, though, to realize is this is not usually a same-day service. So if
that would be pretty hard to schedule.
It is, especially with volunteers. Everybody has a little bit of a schedule they like to keep on. So it's not for those same day, like just last minute, my brother can't bring me. We'll still have to get creative there. But really, if you have an appointment in a week and you just can't arrange transportation, let our front desk staff know in the medical or dental clinic.
Yeah, because I was going to say, for the health center to actually put all this together and schedule who's going to pick up when and how they're going to get to those destinations.
It's a lot to manage.
Yeah, that's gonna take some. I'm going to use your word, creativity.
It will be. Well, and that's where Missouri Rural Health
Right.
Association really comes in. There's 2 or 3 other health centers in Missouri that are kind of piloting this program also, and they've had a lot of success with it. They've seen, lower diabetic A1C rates because patients are able to come in, get their blood sugar checked at no cost to them, and just better health outcomes through transportation. So.
Right. And with the size of the area that you guys serve, which is huge.
It is pretty big.
Somebody may only be able to pick up 2 or 3 people at a time, maybe in one day.
Yeah,
because,
absolutely.
Trying to get them, maybe I have to take somebody from Licking to Rolla and then come back. I got somebody in Salem needs to go here. So, they may be making some rounds.
Right.
And it all depends on what your drivers want to do, et cetera, et cetera.
Absolutely.
So you've got a lot of variables they have to try and put into a constant, don't you?
Yeah, and I'm glad you brought that up, Stan, because I think it's important too for listeners who maybe want to volunteer to drive. You set your own schedule. So if you say, I only want to drive on Tuesdays, we'll take it. There's no minimum amount of hours or days or times that you have to be available. If you say Tuesdays from 10 to 2, we'll take you. And, we're really trying to be mindful of the drivers. If you live in Salem, we want you driving Salem residents. If you live in Cuba, we want you driving Cuba residents. We don't expect our drivers to go all over, unless they just want to. If somebody...
Well, if they offer, right?
If they offer, we'll take it. We're not going to turn anybody away. It's kind of like the health center. We'll take them all.
And going off of what Kelly
Sure.
said there, it's not a super lengthy process to get signed up as a volunteer driver. There's not very many requirements. You do have to go through the background check, and you must have 3 years of driving experience. So there's not necessarily an age limit, but you do have to have those 3 years of driving experience, and then a vehicle inspection. But other than that, if you pass those, you're good to go.
So
and
no special licenses are needed.
No special licenses. Okay. Nobody's going to be driving a bus. And no 16-year-olds are going to be taking our patients.
And it will be covered by their insurance, so it's not your personal insurance that's covering it.
Okay, so very good. So, if somebody has an interest in this, and of course, we've all known for years about the lack of transportation, and there's just no really one easy answer because, when you get in the rural areas, it's not like these towns, you go to metro areas and the towns are backed up against each other where you can go from one to another within minutes. There's nothing within minutes of each other here. It's been half an hour, 45 minutes, 50 minutes, and the roads can be sometimes a little bit on the treacherous side. So, do think about that. If you're going to be driving, that's why they really want to keep people from Salem going to Salem, Cuba going to Cuba, Licking going to Licking. It makes it easier because obviously you're more familiar with that area. I can't tell you if I went to the Texas County Road, 1412, I wouldn't have any idea.
Yeah, I'd be
is.
lost.
And then you're trying to find an address, and so you'd have to be looking. Well, that can be somewhat dangerous sometimes too, because some county roads do get a little narrow at times, and you're trying to find it. And finding a ditch might be easier than finding a house.
Absolutely.
You don't want to have that happen. But at the same time, if you are familiar with the area, a lot of people have friends all over, and they do know a lot of these different areas. If you're willing to do that, Kelly and Taylour and the entire your community health center staff would love to have you say, we'll take them anywhere.
Absolutely. And there is more information on our website. We do have a website page dedicated to the Health Tran, and so there's more information there. You can follow a link. It actually goes to the Missouri Rural Health Association page, so it's a lot to get in on a short radio interview, but there is information on the website also, and you can always just call the health center and talk to Taylour. She is really kind of the resident Health Tran expert right now.
Did you know that right until this interview?
I just gave her that title.
Oh, man.
That'll be on her new business card.
Health Tran expert, I guess.
That's right. You never know what happens when you.
Yeah, well, that's all part of the game, Taylour. Just getting used to it. But one of the neat things about this is that, again, we want people to understand if you have an appointment, don't wait until the day before, 2 days before, a week, 2 weeks ahead of time would be even better, because I'm hoping people see the logistic nightmare on the other side of this.
Right.
We got 5 patients in Salem. We got 1 driver that day. That's gonna be awful difficult to get done. If you have 2 drivers, probably not as big a deal. But if they can only come on a Tuesday or they can only come on a Thursday, trying to fit all that in, find the right drivers to make it all happen. It's like taking the biggest puzzle in the world and trying to paint the little pieces together and put it all there and make it all fit.
Right,
Yeah,
and try to move appointments around too. I mean, if we have a driver from Salem, and they can bring 4 people, we want those 4 people to have a ride. So we're going to kind of move the schedule around with the providers and, so that they can all be seen, hopefully, close to the same time so that it works for as many people as possible. So I'm glad I don't have to figure out that puzzle.
Taylor has to figure out the puzzle.
Oh, Taylor is going to pass on that. We have a whole different mobility manager.
I was just throwing that at her.
Yeah, well, I mean, she is the expert.
Yeah, she is the expert. So figure that out. And so if you have a vehicle that you would like to, and if somebody has a 2-seater, you probably don't want to be doing this too much,
Right.
because they're needing a little bit of room. Remember, people are going to have, you're going to have to get people in and out of your vehicle. So make sure that obviously you keep your vehicle clean, number one, as much as you can, but also make sure everything, all the obstructions are out of the way.
Right.
You don't want somebody to get in there and find that, there's a bunch of stuff on the floor and things of that nature.
Yeah, so my vehicle's out.
Yeah, I've seen your vehicle.
Yeah.
Your vehicle
Lots
is
of
pretty
water
well out.
bottles.
Yeah, water bottles, papers, and different things of that nature.
But that's a great point.
But if you're doing virtually, not too much at home, maybe you're retired, you'd like to be able to help out. This is a great way to do it. Be a part of a community and part of a Health Tran, I'm going to call it that. Yeah, it would be wise for you to make a little contribution back into your town and help your friends. You're mentioning there's a lot of people. I think more people don't realize how many people are actually somewhat locked at land because they only have one vehicle in their family. They can't get out. Once that person goes to work or has a ball game or something of that nature they have to be to or make a commitment, they have no other way of getting here. And this also is in the case that I think we're seeing now too, is people losing their licenses.
Oh, absolutely.
They're not allowed to drive. And even though they are of driving age, they can't drive.
Right.
And the last thing they want to need to do is try and drive over without a license, get caught on the way to see their dentist or their doctor. That would not be a good thing.
Yeah, we don't want to encourage that.
No.
So absolutely. Just helping out. And you don't know. It could be the neighbor next to you that just needs that ride. So
now, how about for children? Is this good for children as well, or does the parent have to accompany the
yeah,
child?
so a parent has to accompany also.
Okay, very good.
Absolutely.
Okay,
But
well, make sure of that. Let's get all the
right,
details
yeah,
out
I know.
there.
See, you always ask
Yeah.
good questions. I'm not even thinking about, but yeah, absolutely. We're not going to send a 5-year-old with a driver that they don't know.
Right.
So parents do have to be with them. And again, we really encourage that if if you're in Salem and you have 3 kids that need to go to the dentist, get it scheduled on the same day. The dental clinic is happy to take care of that for you, and then you just need to arrange it. We just have to arrange one ride. It makes it so much easier. It's easier for the parent as far as scheduling. It's one afternoon off of work or, one afternoon out of school for the kids. And so it just makes it a lot easier for everybody.
Yeah, I mean, and there are so many positives to this program that hopefully people will jump on board. When do you plan on instituting the program?
So I think we're hoping is first ride.
February 1st.
Yeah, February 1st.
Yes.
So, yeah.
Right around the corner.
Yeah.
We're excited.
So we had about 10, I think, people at the first orientation.
Yes.
So we were pretty excited about that. Right now they are in St. James because we had a space. I think Taylor mentioned it's tomorrow in St. James at the Senior Center. We will have one at the Health Center in Rolla. And then I know one has potentially been requested in Salem if we have interest. So absolutely, we are happy to facilitate that. If we have several residents from Salem who want to volunteer and give back, we definitely bring the orientation here to make it a little bit more convenient.
Great, that's fantastic.
Yeah.
So that would be great to have some drivers right from this area to be able to help
we're
out.
excited.
Fantastic. Good, very good. So tell me about the birthday bash. It's on this February 28th. I mean, you're going to have all these things you're kind of talking about, but you're not very vague about all these
Well,
things.
we might be kind of still in the planning. We're trying to do a lot right now, but we're just really excited. I mean, for me, it's unbelievable that we've already been around for 5 years. the amount of growth. We were looking at some numbers. The first year at the health center, we didn't even serve 1,000 patients. Now we're up to almost 6,500 patients and over 18,000 visits a year. So we're just really excited, and we're a community health center. Every chance that we get, we want to give back to the community. So Taylour and I are planning a little bit of fun. As always, there'll be information on the Facebook page.
Yes,
when we know. But I think we're going to have a live radio remote possibly at the health center, and just do some giveaways and some patient education, and just a little bit of a fun day, and just kind of celebrate with staff and our patients.
That's good. Now you're getting your 5 years, have you gone back and looked at how many patients?
Oh, absolutely.
You see how it's grown and grown and grown, and check on how those patients became part of your family now.
Yeah, absolutely.
Sometimes that's pretty interesting to figure out.
It is really interesting, and looking at the amount of patients that have stuck with us, and and the growth has just been, it's been amazing. I remember, I started a year after we opened, and we saw about 1,500 patients that year, and man, it was kind of quiet around the health center. It's not quiet anymore. No, it's not quiet anymore. So it's nice. Growth is good, but still being small enough to feel like part of the community is a good thing also.
And let's just touch on all the services that you offer, because I think some people may not be familiar that they most know about Smile-Mobile. I think,
I agree.
Hey, everybody knows about Smile-Mobile. Yeah, they've seen it around, and it was actually down in Healthy Dane County for a whole week.
Yeah, it's
great.
great.
It was down there, and a lot of people had a chance to get service. But you guys offer a wide variety of services.
We do. So we have primary care, so medical services. We have a full freestanding dental clinic. Well, I guess it's not freestanding anymore. It's with the medical clinic, since May. So
that kind of combines.
Yeah, it's nice.
Okay,
it's really nice for our patients because all of the services are in one location, so you can make a medical and dental appointment in the same day. But we do have two full-time dentists in the dental clinic. We have 2 dental hygienists. So wide array of dental services. There's pretty much nothing that we don't offer except for braces. No orthodontics right now. And then we do have behavioral health services.
Right.
We have a licensed clinical social worker. And one of the new services we've added to the health center is our substance use disorder treatment. We are doing medication-assisted treatment right now in the clinic. Dr. Porter is taking care of patients who are dealing with opioid use disorder. And so we've been doing that since about the beginning of November.
I was going to say, it's another new service.
It's another new service, and it's a much-needed service in our community. And I think what a lot of people don't know is we offer that service for Medicaid, private insurance, and self-pay on a sliding fee scale. And we also have, prescription program 340B that can help with the medication for those services. So a lot of times, it's not coming in for the appointment, but it's the prescription. That's the barrier. And so we do have prescription assistance programs that we can help with that cost also.
See, and these are all services that most people may not know that you offer.
Absolutely.
Because no matter, we can always just do ads and stuff, but sometimes until it actually hits you or you need that service and you don't know where it is.
Right.
It's unfortunate that's how our life. We're so busy in our lifestyle. We hear something and I know somebody offers that here, but I just don't know where it is. If you know somebody that has that kind of need, if you have an opioid problem, you have an opioid problem. You need help.
You need the help.
If you don't get help, it's just going to get worse. And there's just no other way of putting it. It's not a pleasant thing to say that, once you get kind of hooked on opioids, you're kind of hooked on opioids.
Right.
It just doesn't get easier. Get help. Don't let that take over your life. That is not something. We talk a lot about different things that go on at the clinic, and you offer these services. And this is to any age group. This is not
Absolutely.
just, some people say, well, they only take Medicare, and they only take Medicaid. No.
It's everybody.
Come on in.
I always say, we get the benefit of serving the underserved because of federal funding, but we're just a normal clinic. We take everybody, and And that's just the truth. We just get the federal dollars to take care of the patients who need some extra help on the sliding fee scale. And another service I should mention is a lot of people in Salem are familiar with Brett, our community health worker.
Right.
So it's not just medical and dental and behavioral health. He helps with housing, food, Medicaid applications. He's helped patients at the job center. So it's all of those other kind of soft, typical things that are maybe not always considered medical, but we know if you don't have a house, you're probably not worried about your diabetes. And so really the case management and the community health worker is just as vital to our patients as all the other services that we offer.
And that's what I want to bring out, because there's a lot of stuff that goes on behind the scenes. I have had the opportunity to come to your building and see all the stuff going on in the back, behind. And it's pretty incredible to see how many different people are working at getting things done, different grants you apply for, always looking to provide a different service or a new service or a service that you guys have meetings that you find this is not being addressed in this area. Somebody needs to address it in this area. Let's see if we can do it. And I applaud you guys for doing that, because you do a lot of research in trying to find those grants or programs that you can complement what you have now, not replace what you have now.
Right.
Just complement it. That's difficult, because no matter what you do, sooner or later you start running out of space. But you guys really,
we're almost there.
I know, but you guys really work it pretty well to where that space is still available for those services that you offer to anybody that needs them. And and again, as I mentioned, you guys continue to look into that next, I don't want to say adventure, but maybe into that new venture that might be out there, or maybe a new treatment that might be coming out that it's nowhere else in this area that something you might be able to provide. It's not an easy thing, because you have to go, Kelly, you might be able to answer this a little bit more. It may take you over a year through grants, meetings, discussions to try and even implement a program, because you have to jump through hoops and barrels to make sure that you follow every protocol that's set up with that program. Am I not correct?
Absolutely. And I think as a community health center, the other part of that is building the right partnerships in a community. I mean, we provide, we provide primary care, but there are so many other services that we don't provide. We have to have partnerships with local other healthcare providers. We don't do x-ray. We need to partner with the hospital, like Salem Memorial, to, refer our patients for x-ray or mammogram, because we don't offer those services. So partnerships are critical for what we do as a community health center. We cannot succeed at what we do if we don't have strong community partnerships.
Right, and now you're partnering with people in the area to bring you Health Tran.
Absolutely.
Right.
And the experts right here.
I know, right? What a great morning.
I'm telling you what, and that really is exactly what it's all about. When you say community health center, it is community health center. It's your community health center. It helps your community. That's why the name is so absolutely perfectly and apropos for what you do. You have each community help themselves to help get them to your destination and get those services done. Or when that can't be done, you bring a Smile Mobile here.
We try.
I mean, that has been a wonderful cooperation between Denton County and your community health center. You guys have done a tremendous job, and you continue to do a good job. And we want to remind people, if you'd like to be part of Health Tran, this is a new service. Not replacing SMTS. Don't get us
not
wrong.
At all. Well, actually, we're going to partner with SMTS.
But what I'm saying, I don't want people to get the idea that, well, what happened to SMTS? SMTS is SMTS. It's still going to be around, but this is going to be a little bit different. It's a complement to SMTS.
Absolutely.
How about it? We use that term, and unless you're mentioning, you're going to end up working with them as well. But let's let people know that there is going to be another option for getting transportation. And if you would like to be a part of that, and that's what we're really here to talk about, trying to get people on board, understand you do not have to do this 5 days a week. You can do it 1 day a week. You can do it for 6 hours. You can do it for 10 hours if you want to. If you want to pick up people in the entire Ozark region, boy, I'll tell you what, they're going to love you.
That's right.
but if you can only do Salem, that's fine. But they'll take whatever they can get, whatever time you can give to them is appreciated. And remember, you're getting 80 cents a mile.
Yeah, that's pretty good.
IRS says 58.
Right.
So you're making, 22 cents on it.
Yeah.
Not very often you get to beat the IRS.
Right.
But it's just a great opportunity for some people to help out your neighbors, help out your friends, be a part of your community, and then help people get the services that they need. Not much better than that.
Agreed.
Right.
You get a good feeling inside yourself, especially you see a young person that's got some problems, and you can get them over there and they can get them taken care of and come back, and they got a smile on their face when they get back home.
That's a good
That's
day.
gonna make
Yes.
that's gonna make that ride home real good.
Absolutely.
Really good. So, what numbers they need to call to talk to you, Taylor, about being a part of Health Tran? What number would you like them to call?
Yeah, definitely. Give us a call at 573-426-4455.
Okay.
And you can also go online. Like we said, we have information on our website that will link you directly to Health Tran. Or I highly encourage you, if you are available tomorrow, to attend our informational session or the one at the end of the month on the 30th as well. And we'll have more information about that on our Facebook page and
Okay.
our
very
website too. So again,
good. Can they email you from your website if they have a question or two about the program? Is there
yes.
an email contact
There's a
on there?
contact on there, yes.
Okay, so what time is this tomorrow in St. James?
1 p.m.
Okay, and what time is this at your community health center on the end of the month?
To be determined.
TBA.
Yeah, but I would say probably around 1 o'clock.
Okay.
That's been a really good time to
Okay.
get volunteer
All right.
drivers in.
So we at 1 o'clock tomorrow at the St. James Senior Center.
Yes.
All right. And do they need to bring anything with them? At this time, it's just informational, right?
It is informational, yes.
So if they haven't, you know what you bring with you? Any questions you might have.
Absolutely.
Yes.
If you'd like to do it. And the roads are clear. Trust me, I drove them yesterday, so you got no problem getting to St. James. If you'd like to go to the St. James Senior Center and find out more about this program, I highly recommend it. I know that we've talked about how tough it is to get people there, and how great it would be to have a transportation system here. I can see the pitfalls of trying to do one, because if you don't have a number of different vehicles and you get called to one, because of the vastness of Denton County, you're not going to be available for
Right.
maybe over an hour and a half or 2 hours. So if you don't have a fleet, I guess we probably want to say, and instead of having a fleet of cars, your community health center would rather have a fleet of drivers.
That's right.
Okay, that would be able to take care of people. So whether you're from the Sligo area or whether you're coming out of near Bunker or wherever you might be, to go pick somebody up, be right there. You might be 45 minutes just going from one location to another, still within the same county. That doesn't happen very often.
No, it
It
doesn't.
does in the rural areas, but it doesn't happen in a major metropolitan area if you can get someplace pretty quick.
Right.
So that's why we really need drivers. If you'd like to be one and you'd like to be part of Health Tran, just give Taylor a call, and she'll be more than happy to help you and answer questions, or show up tomorrow in St. James.
Yeah.
1 o'clock at the St. James Senior Center, or at the end of the month at your community health center at a TBA. we'll give you more information on that one as we get closer, but do want to thank you guys for coming in, spending
thank
some
you for
time
having
with
us.
us.
Yes, thank you.
Always a pleasure to see you and talk with you about the different services you offer, and really, again, thank you for those services that you offer, and continue the good work. Hope people do understand that health care is not an easy thing. And we have our Salem Memorial District Hospital. We do know you guys work in conjunction with them. They do not try to replace them.
Absolutely.
They work in conjunction with them. There's a nice partnership, as you mentioned there. And so if you have questions that you need answered, your community health center can answer them, but if they can't answer them, they're going to send you right to our Salem Memorial District Hospital to get those answers or services that they don't provide.
It's all
Pretty
about the
simple,
partnership.
right?
Yep, it's very simple.
is.
It
yeah.
sounds simple. It's not that simple.
That's a whole nother conversation.
But the premise is that's what it is. It's working together to give the best health care in our area we can. And you guys do a
Absolutely.
tremendous job. And now we need the transportation part of it to send it to the next level.
Yep, this will be a start, hopefully.
It'll be a start. As always, thanks guys for coming in. Taylor,
Thank
and
you.
of course Kelly, we appreciate you guys spending some time with us on this Tuesday morning. It's the Ides of January.
It is.
It is. You know what the
Absolutely.
Ides are, right?
No.
Put her on the spot. Just say it.
Did you ever read Julius Caesar?
I was going to say Little Shakespeare.
No.
never
I mean, yeah, but that's been a few years.
Okay, well, what is the Ides of March? You remember the Ides of March? That's a long time ago.
It's been a few
Yeah.
years
Means
in 1 year, kind of.
Beware the middle. Remember the Ides of March. Yeah.
Not a Shakespeare expert.
No. So here we
No,
are.
but I am a Health Tran expert.
There you go. There she's on top of this. She's woke up now.
Yeah.
Right?
Well,
Hey, it's past 9.
Yeah, right.
Caffeine is taking effect. Very good. Hey, guys, again, thanks for coming in and
Thank
spending
you,
some
Stan.
time with us right here at KSMO Radio 1340. And we do have coming up next our Bass Pro
Thanks.
Outdoor program. It's brought to you as a courtesy of all of us here at KSMO Radio 1340 AM.
Clean water's important. Coming up on Bass Pro Shops.